For a patient to be discussed in CPMS 2.0, appropriate consent needs to be collected in the treating healthcare provider, or HCP. Please remember that only patients treated within the EU are allowed to be enrolled in CPMS 2.0. A special administrative agreement between the EU and the Ukrainian Ministry of Health allows also for patients in Ukraine to be discussed via CPMS 2.0. According to the ERN legal base, each healthcare provider acts as joint data controller for patient information processed in the context of the work of the ERNs using the CPMS 2.0 platform. As joint controller, each HCP is responsible for creating and managing their own patient consent form and archiving all signed forms. The national supervisory authorities oversee compliance of patient consent forms with the General Data Protection Regulation (GDPR). The European Commission recommends using the templates, which are aligned with all functionalities of CPMS 2.0. However, the choice to use the templates or another form remains at the discretion of each HCP. Regardless of the chosen template, the patient consent form must include the official contact details for both joint data controllers, the HCP and the European Commission. The primary consent, which is the consent for care, is required for enrolling patients in CPMS 2.0 and allowing discussion of their cases. The secondary consents regarding education and export to registries are optional and not mandatory for patient enrollment and case discussions. You can find the templates and instructions for completing them in the CPMS section of the ERN PaedCan website. Signed consent forms shall not be uploaded to a CPMS or sent to the European Commission or ERN, but rather archived by the HCP in accordance with the national applicable data protection regulations.